What's your name and who do you work for?
I'm Gabby. I am a neonatal intensive care unit nurse at Vanderbilt Children's Hospital in Nashville, Tennessee.
Describe the main responsibilities of your position.
Well, I feel that as a nurse we have many roles and responsibilities, but particular in the NICU and I guess in general, just making sure that our patients are safe, and that involves making sure that double checking with pharmacy, making sure that doses for our medications are safe, giving those medications, communicating with the team on any changes that we know in our patient status, which is a huge role, I feel, in my job. We are the primary caregivers. We're there at the bedside 24/7. So I would say that is one of our greatest roles in talking with the family and being an advocate for our patients and making sure they get the best care possible.
What is the most satisfying part about your job and why?
I would say as a NICU nurse, just seeing how such a vulnerable population can really progress and see how resilient they are. And especially if I am paired with a primary, which is basically a patient that you have every time you come on shift, who tends to be very chronic and comes out doing really well, and hopefully sometimes it can come out really bad, but just seeing the progress that they make and helping the families, cope through the difficult times that they face.
What is the least satisfying part about your job and why?
I would say the least satisfying part is sometimes in an ICU setting, you are paired with patients where you do tons of interventions and nothing seems to work, and it almost kind of gets exhausting. So I guess just the worst part is, not seeing progress in our patients, even though we're trying everything we can, and that can be kind of a negative impact on your day at work.
How did you decide to get into this field?
I would say that I followed the footsteps of my aunt, who also worked in an ICU setting, and she just thrived off of working in an environment that involved so much change. And initially I thought I wanted to be a teacher for the longest time, but thought I would kind of get bored of it. And I also saw her in a place where she helped our great-grandmother during her last days of life when she had cancer, and took her in and kind of set aside her life to help our grandmother. And I've always wanted to be in a position where I could help people, but also apply my interest in science, and I think that's it.
Tell me about the training and education you've had. Has this helped you in the field? If not, what has?
So I went to the University of Rhode Island. Those 4 years were definitely packed with all sorts of learning. So that definitely helped in the science-based part. But as I got into the NICU, I found that only a fraction of one semester has really helped me know the anatomy of the babies, because they're just so unique to humankind in general. But I also got some experience being a nurse assistant at a acute rehab hospital, and that helped tremendously with communication skills, learning how the hospital worked, learning what rounds were and how doctors played a role, or PT and OT and all that good stuff. So that was a huge component to kind of adjusting to my role now as an RN. And that's about it. But school played a huge role in knowing, kind of getting you geared to thinking, anticipating what could happen next with your patient and what to do.
What recommendations do you have for someone wanting to enter or progress in this field?
I would say go for it. There's so many options in nursing, even if you're a little hesitant with, what exactly you want to do, or if bedside nursing isn't exactly for you, and just job shadow everybody, because now I'm in the position where I kind of want to go and get my master's and whatnot, and I feel like a lot of people, once they become bedside nurses and are thinking grad school, they just don't really know what path they want to go into. So I guess my greatest recommendation is to just keep shadowing different kind of roles, like inpatient and outpatient, and just keep with it, because it is a tough program, but it is fully worth it in the end. It's very rewarding, and I highly recommend getting a job before you go to apply to be an RN and get some experience being a CNA. That will help with your resume greatly.
What advice do you have for being a successful student studying to be a nurse?
So nursing school can be overwhelming. My greatest advice is just to start early with studying. I know the type of student I am, and it may sound psycho, but I would start like 2 weeks before a test to just kind of do bits and pieces, and then maybe like the week before, I would really just keep going over and over the info. So basically, if you have a test like in physiology, take that subject of whatever it's on, and on Monday do one chapter or section, Tuesday, etc. And then once you get back to the next Monday of the second week, just kind of keep going over everything that you learned, and it'll really stick. But flashcards were great. Study groups weren't really my thing, but a lot of my friends did well with those. And just, I think mostly just taking the time to look at all the info and go over it multiple times.
What skills and personal qualities are important for success in your field?
I think nurses have to be empathetic. You're dealing with a lot of different people who may not be in the same situation or any situation that you may face in the future, and to just kind of be there for them and have an open mind. You also should be able to kind of anticipate what could happen to your patient during a shift. Just kind of being on your toes, and just willing to help them when they need it. And also just compassion for helping others. You're going to get worn out if you are not a people person, because you are basically the center and heart of the hospital and the person that's at their side through all of it. So you definitely have to be good at communicating and working with others.
What is a typical workday like for you?
Typical workday is typically I'll get my assignment, go in, get report from the nurse that had my babies, and do kind of like a safety check on both of them, assess them. The doctors and the whole healthcare team will do rounds on all of our patients, so that's where they kind of go over numbers and labs and whatnot, and what will be the plan for them for that day. And we address any concerns that we have about the patient, and then we make changes as needed. And pretty much just giving medications on time, feeding the babies, helping parents if they need to breastfeed, or mothers if they need to breastfeed, and address any questions that residents or families might have throughout the day, and kind of being that support system. Definitely gets busy, but kind of hard to sum up in a little, few sentences, but and then we wait till the next ship comes in and we give them report and head on out.
What are the opportunities for promotion and advancement in your field?
So as a NICU nurse, I could be a charge nurse if I really want to be in the future. and which is kind of cool because you can attend deliveries and you're the support system for the rest of the crew that's working. I could get at Vanderbilt. We have a weird system with promotions and education and whatnot, but I could become an RN3, which you do projects or research into finding ways to make our hospital system better, and improvements, and it goes through the whole board and of nursing and gets approved and whatnot, and then outside of the NICU, I guess my ultimate goal would be a nurse anesthetist. So obviously that involves more education and experience in different units. So I guess that's what, for me personally, my promotions and improvements and whatnot.
How do you feel this field is expanding or changing?
So I feel like nurses are becoming more and more independent with evidence-based practice, and I feel like they are becoming more, not that they were never a vital component, but even more knowledgeable of certain aspects of patient care, and there's more and more nurses that want to, that are going to school and coming to the hospitals and working, but there's also a strong push for nurses to get further education than an RN. I know at my school they always say, go back to school and all that good stuff, and I think it's awesome that nurses have so much opportunities, and that you can really, take advantage of, and really finding your passion in this field. And nurses are really becoming a driving force of healthcare, and I think it's awesome.
What is the entry-level salary range for this field?
Good question. I think that's anywhere around 60 grand, but obviously that can vary from state to state and which setting you are working at.
What professional organization should I consider joining as a practicing RN?
One organization I'm a part of is Sigma Theta Tau, which is an honor society for nurses, and it's just a really good network. People that can help you find a job one day, or different community kind of groups that are focused in certain areas of nursing that might be of interest to you. And it's really just a great, support system really wherever you live. It's international, so there's groups of nurses everywhere that are part of this, and it's just a really good support system especially as a new nurse and throughout your career.